Hi, Mr. Jones. My name is Amy and I'm a respiratory care student, and I'm here today to draw some blood. And I looked at the charts and it shows that you're on an anticoagulant. So with that, at the end, I'm going to have to hold a little bit longer than I would normally. So with this, it's called an arterial blood gas draw, and it's not like a regular one. We are actually taking it from your artery. So you're going to be taking it from here for your radial artery. And so it might be a little more painful than normal for the patient, so we have to make sure they understand it's going to be a little sharp pinch for them. And it's going to feel a lot of pressure coming from there. So before I begin, I'm going to make sure I have the correct patient. I'm going to check their name and date of birth. Then I'm going to assess the patient and make sure I get their vital signs before I take the arterial blood gas sample. So I got all the assessing done, and so I'm going to make sure my hands are clean again. I wash my hands. I'm going to apply the proper gloving, and if I want a mask on. And so I'm going to get my kit ready. I have my needle. I have my stopper for when I'm done with the needle, my plug, a Band-Aid, my gauze for the patient to stop the bleeding. I have my alcohol prep wipe, and then I'll have my label. Alright, so before I begin, I'm going to make sure I do the modified Allen's test. So with that, I'm going to have the patient make a fist at least 3 times while I am holding the ulnar and radial artery. So after they've done it 3 times, I'm going to release the ulnar artery, and I'm going to feel for the pulse. And I'm going to use these 2 fingers here as I make sure I have the pulse, and I'm going to watch to see if the skin coloration comes back within 3 to 5 seconds. And if it does not, then I will switch to the other arm. So when I am ready, I'm going to make sure I can palpate the pulse, and with the gloving on, and I'm going to remove the cap off my needle, and I'm going to make sure this is clean. Before I actually do the needle, I need to make sure this is properly cleaned with an alcohol prep wipe. And so I'm going to hold this at a 45-degree angle, and I'm going to palpate the pulse, and once I'm ready, I'm going to get it right where I need to, and I'm going to stick it in. And then I should be able to see blood start coming through to the appropriate size. And so once I'm done, I'm going to make sure I have this and hold it, and I'm going to place my needle. I will place the needle in a stopper here, and I'll push down on it, and it curls the needle, and I will dispose of the needle into a sharps container. So when I'm holding onto this, after I'm done, I need to place my Band-Aid on the patient's thing there while I'm holding it. So when I get ready, I'm going to have the needle, and I'm going to place a cap on this needle, on the syringe. That way it holds in the blood, and make sure I don't get any air pockets, anything in there with it. So then I will create my label. So on the label, I need to make sure I have the patient's name on there, and I need to have the physician that wanted the order, the date that I did the procedure, and then I need to put if the patient is on oxygen. So if they are on a Venturi mask, I'll make sure I put the exact FiO2 that the patient is on, or if they are on room air, the 21%, and write room air on it. So I will place a label in there, and I'll place my needle in here. Now if I can't get to the lab right away, I need to place my blood sample on ice. So once I'm done, I'm going to make sure I dispose of everything. There's no needle anywhere, all the blood, everything is gone. And I'm going to reassess the patient, make sure they are okay, make sure they are feeling okay, they don't feel faint before I leave the room. And then once I'm done, I'm going to wash my hands, make sure the sample gets to the lab, and then I will record everything in the charts.